Every year, HSC Children's Hospital sees between 80 to 100 injuries related to all-terrain vehicles. And these are not just broken bones. The injuries doctors are seeing are serious, including spinal cord fractures and even head injuries leading to surgeries and hospitalizations. Joining us now is the pediatric emergency physician at HSC Children's Hospital, Dr. Lynne Warda. Good morning, Dr. Warda.
Good morning.
Thanks for joining us. Now, when a youth comes into ER from an ATV injury, what are you seeing when they arrive?
Typically multiple injuries, so it could be head, neck. Often there's a broken bone or maybe two. They also can have burns from the hot exhaust manifold, lacerations, usually multiple.
And these are serious injuries as well.
They're very serious. Some need intensive care. Some need operations. About a third of them actually have to stay overnight in hospital or for days.
Now, most of these injuries happen on weekends, is that right?
About 60% occur on Friday, Saturday, or Sunday. Not surprising because they're for recreational use for the most part. At least that's where we see the injuries, where kids are just having fun, and that's more so on the weekend.
And so what ages are we looking at here when it comes to some of the injuries you're seeing?
In our database, we have injuries as young as 1. We have some 2-year-olds, some toddlers, obviously more common as kids are using them more frequently. So the peak is more in age 12 to 16.
Okay, and are they usually wearing helmets?
Usually not. At most, a third are wearing helmets and some not the appropriate type of helmet.
Okay, and so let's talk about some of the most common types of crashes you're seeing with ATVs. Are they rollovers? Are they head-ons? What are you seeing?
Yeah, so losing control of the vehicle is one of the most common factors leading to an incident. So absolutely rolling over, sort of tipping, going up or down a hill, running into stationary objects like trees or the side of the barn or things like that, falling off, passengers falling off and colliding with another vehicle, even a motor vehicle.
Now, these could be life-changing injuries, right? What message do you have for parents?
First of all, is to really think twice when your child is in that younger age group. Canadian Pediatric Society recommends 16 as the minimum age. In Manitoba, you are permitted, to have your child, as long as you're supervising them, operate or ride on an ATV. But really, this is not, this isn't a bike. This is a motorized, very powerful vehicle. So for the younger kids, if parents insist on using them, there are youth sizes. There's even sort of mini ATVs that go at a very low speed, sort of electric. Those would be better than, putting them onto the full-size ATVs.
Okay, so if they do use them, what safety measures should riders take before they head out on an ATV?
So knowing how to operate the vehicle, just like riding a bike, learning how to drive a car, there's learning the rules of the road, how to operate the vehicle, and then there's the equipment. So wearing a properly fitted and appropriate helmet. They recommend long pants, proper footwear, not wearing your Crocs while you're operating your ATV. Gloves, eye protection. So it's really a full get up in terms of the safety gear that is recommended. Yeah. MPI has some great tips and detailed information online about that as well.
Dr. Warda, it seems that we talk about this every year. Do you think, is it getting harder for you to see some of these injuries and some of these kids that are injured so badly?
Everyone is hard. Every single child that comes in and is severely injured, or even having, a really bad broken bone. It's not fun. This is a lot of pain. It's a lot of recovery time, sometimes operations. And it changes their summer. I mean, the rest of the summer is, lost to putting your leg up on the pillow, with your fracture. So, even the short-term consequences are significant. Mm-hmm. But we really, don't like to see the injuries where it's much more serious and there's going to be long-term consequences.